I think probably one of the biggest things I'm most proud of was working alongside Chairman Mazzaros in a collaborative effort to stand up the Research and Innovation Institute, which is an opportunity for boards of pharmacy, academic institutions, as well as stakeholders and innovators in the technology space to come together to work on enhanced abilities in pharmacy practice and different digital pharmacy practice models.
Networking is great, getting to know your not only neighbor states that we get to see with NABP in the districts, the NABP staff that help us with all of our day-to-day functions, plus everybody else in some of the other states. So when you see or hear a name or something that's going on in a state, you can relate that to a person, which makes it a lot easier to come to a conclusion.
So there are a lot of exciting things going on at NABP and that we've been able to do through the executive committee, but I would have to say the most exciting one is Pulse. As you look towards the future of pharmacy, there's so much going on and happening, changing. And Pulse, the team has done a fantastic job with Pulse and setting that up, and it's been able to protect patient safety, not just on a national level, but on a global level.
It is really one of the few opportunities for colleagues around the country who do exactly what I do to sit and talk about the issues that are important to them. I say that to say there are lots of conferences where you can be around other attorneys who practice pharmacy law or to be with attorneys from different roles practicing pharmacy law, but this is an opportunity to really sit in a room with other board counsel practicing Board of Pharmacy regulatory work.
And being a healthcare professional and a pharmacist in particular, we take the oath to protect our patients. And being an independent rural pharmacist and owner in North Dakota, I take that to great heart. So our mission really aligns with our profession. Our sole job, number one, is to make sure our patients are taken care of, and that is protecting public health. And so it's a simple fit for what we should be doing in taking care of our patients. And it's a good alignment, and I'm just proud to be part of NABP pushing that mission, because that's what we should be doing as a profession every day.
I think, just listening to some of the conversations today kind of gets me thinking how I can bring some of those same focuses and issues back to my home state and be able to help with our board members and legal counsel and maybe make some difference and increase regulatory framework. So I think what we do and discuss in these meetings seems to be able to transpire into your home state.
And the focus will always remain on protecting the public health. But in the short term, I think the focus of the executive committee between, say, now and the annual meeting will be to continue to implement Pulse by NABP. We'll also be looking at interstate license portability, which includes the option of using the UMPJE, and then our continuing ongoing competency assessment of upcoming pharmacists.
Board members actually have the opportunity to really discuss and collaborate relevant topics on the profession at district meetings and also at the annual meeting. But I really feel like the NABP Forum really does a great job of rounding out the discussion by involving and incorporating those other attendees, such as compliance officers and board attorneys.